Hi, this is your Commissioner, Melissa P. Dunn, and I am so excited about today's community conversation. This is a time when I bring you experts from around the community who are doing amazing things to make us healthier, to make our community not only healthier, but safer and more prosperous. And today's conversation is really exciting. I'm going to be speaking with Mr. Michael Garcia. Michael is an American Lung Association ambassador. He is really working with the team for the Turquoise Takeover, and we're going to be talking about that. But guess what? Mr. Garcia is also an attorney. He actually specializes in constitution, healthcare, textile, real estate, and government affairs. And in fact, he was an assistant city attorney for a neighboring city in Lauderdale Lakes. Michael, welcome to the conversation.
Uh, good morning, Commissioner. Thank you for having me here. It's an honor to be here with you to talk about the Turquoise Takeover.
So, Michael, tell me, what is a turquoise takeover exactly?
So, the American Lung Association has this Turquoise Takeover. It's a way to bring awareness to lung cancer, and turquoise is the color to bring awareness to lung cancer. And they always shoot for a week leading up. It's always leading up to Mother's Day during that week to bring awareness. It's just like any other organization that says we're going to bring awareness to this cause. We have this whole week. Turquoise is the color, and I don't know if you can see over my back. That's that turquoise back there. There's a gala on the 15th next Friday at Gulfstream, and it's just bringing awareness with the turquoise. And this whole week, we've had multiple events, different events, just to bring awareness to the community about lung cancer because lung cancer is the number one killer of people. It kills more individuals, it kills more women than breast cancer, but it doesn't have that notoriety.
And why is it important for us to know about lung cancer, Michael?
So, because it's killing today, there'll be 356 people that die from lung cancer
Oh, wow.
per day.
356 people per day die of lung cancer.
And every 2.5 minutes, the person is diagnosed with lung cancer. Kills
Wow.
more people
And
than any other cancer. This is the
mm,
number one killer. This cancer kills more than any other cancer, right?
wow.
Um, but it doesn't get that notoriety. It doesn't have it doesn't get the research that's necessary for it. Um, and in Florida, 1 in 3 South Floridians will be affected either through lung cancer, COPD, or asthma, right?
Okay.
Um, when I started 10 years ago, I didn't know anyone. I didn't know anyone. I just thought it was a good thing to get into.
Mm-hmm.
Something else bigger than me. Unfortunately, my mother-in-law has it now. It's gonna
Mm,
touch. It's gonna touch everyone. Whether it touches you, it touches a family member, a brother, a sister, someone you know, and it's sad because everywhere I go somewhere and I talk about this, someone comes up, hey, my brother died of lung
yeah.
cancer.
Yeah.
Or I'm going through this, or someone that I know is going through it. So it's
Yeah.
important because awareness allows us to get the necessary treatment ahead of time. When you get a physical, they ask you, hey, do you smoke? Most of the time you say no. They don't even ask you to do a screening for your lungs. There
Hmm.
are people, there's a percentage of people that get lung cancer that never smoke.
Wow.
They never smoke. The reason I got involved is when I was with when I was with Leadership Broward, all the organizations did a presentation. The American Cancer did a presentation, and their presentation was it was a mother. She was 36, 37 years old, 3 kids, never smoked, healthy, did all the right things, and then she got diagnosed. Unfortunately, she got diagnosed when it was already stage 3, stage 4. It was
Wow.
already too late in the game.
Mm-hmm.
Survival rate for all cancers, right? The early detection is the key.
Mm-hmm.
Early detection is the key. Same thing with lung cancer. But most people don't get that screening. By the
Yeah.
time they find out, by the time it starts showing up and you start what's going on, it's already at a late stage. You know,
Okay.
so it's important for that reason alone is for people to know, hey, when I go get a physical, hey, talk to the doctor about getting a screening for your chest, even though you
Yeah.
never looked. People say, well, here's the other issue.
Well, before you go into that, you said a couple of things that I want to unpack a little bit so that we can educate the community, right? So you mentioned smoking. What are the risk factors for lung cancer?
So I was going to go into that. 90% of lung cancer is attributable to smoking.
Okay.
So out of 100 people, 90 it's related. There's a 10% that's not related. So one, stop smoking, don't smoke. Another issue, vaping amongst our young people.
Mm-hmm.
People, oh, I'm vaping. That's not like it's the same thing. It's even worse, right? So, oh, I don't smoke cigarettes, but I vape, so I'm not going to get it. No, it does the same thing. So smoking is the first thing you can do is don't smoke, don't start smoking, or if you are smoking, stop,
For
right?
sure.
That's easy. Well, it's not that easy for people to smoke. Obviously, there's an addiction to it, but that's one of the biggest things. That's if you stop smoking or you don't smoke, then you increase your chances of not having lung cancer. Still, you can get it. And people say, well, if you don't smoke, why do you get it? Why do women get breast cancer? Right? Or why does anyone get cancer? Sometimes there's a specific action like it's smoking, but there's people that never smoked in their life and they get lung cancer. So it's
Is it something that could potentially run in the family and be genetic? Like if you're say my grandfather, for example, died of lung cancer, right? Does that increase my chances of having lung cancer
you
as a
know
non-smoker?
that is a really good question, but I would say if your father died of lung cancer, he never smoked, then you should be checking for that, right? If you
Yeah,
smoke,
having
it's
a
one thing.
conversation with my doctor.
Yeah, that conversation with the doctor is critical.
Yeah, for sure, for sure. And you mentioned, Michael, that getting screening. What does a screening look like for lung cancer? I
There's
know
a
you're not a doctor, so
so the machine looks like any of those machines that you lie down and they put you through like a CAT scan, or,
sure.
but it's just doing a screening of your chest, right?
Got it.
It's not the issue is it's not a cheap test either. If you have health insurance, it can be done, and doctors, oh, you never smoke, so you don't need it. I tell people you should still you have you have the health insurance, get it done. The
Mhm.
American Lung Association has a program where you can register. If you meet certain qualifications, you can get it. If you have some insurance, it can come at a lower rate. That's something that I've been pushing. The
Mhm.
the association is let's try to make this more affordable for people
Mhm.
that we can do those screenings for free or very low cost for
Got it.
individuals that don't have insurance, right? It's just like doing the mammograms and stuff. I said we need to do the same thing. It's a process, but I've been pushing. We need to find a way to make this screening more affordable, especially for people that don't have insurance, or that are low income, because it affects everyone, right? So
What does the American Lung Association recommend in terms of screening guidelines?
it's really going to the doctor, having a conversation, getting that screening. Obviously, like anything else, um, you probably like, for example, if you get a rectal exam for prostate, they say you're good, and then come back in 5 years. So
Okay.
there's got to be something like that. I don't know it specifically.
Okay,
Um,
yeah, no, we can find out and we'll share it with the community. Because I know with other cancers, they say, for example, for colorectal cancer, right? They say that you start getting screened at 50. So I'm just curious what the lung cancer screening guidelines are for the American Lung Association. But tell me about the Turquoise campaign, the Turquoise Takeover.
so this week we've been doing a bunch of events. Um, we partner up with we get municipalities such as the city of Lauderhill to give us proclamations, turn turquoise. Dania Beach just did something. I know you guys are going to do something. The whole
Mm-hmm.
staff in turquoise. We take pictures. Um, we host events at several venues. One year we had buildings during the whole week down in Fort Lauderdale.
Mm-hmm.
Turn, turn the building turquoise. Las Olas does it where they have the flags and the Las Olas Business Association turns turquoise. And the key is just raising awareness. A key function of it is raising money, like anything else. It's raising money, right? The gala is about raising money. I am going to be a celebrity dancer.
Oh,
Um,
that's gonna
so
be
if you can see
fun.
the thing,
That's gonna
the
be
picture
fun.
of me over there. I'm going to be dancing. I'm competing against 5 other individuals in the community, some doctors, some attorneys, some people in the community, as a way to raise funds and raise awareness. I am a
And the
big,
fun,
I'm a big proponent of raising awareness. If you raise
sure.
awareness, the funds will come.
And the funds are used for what?
The funds are used for research. The funds are used for uh, next year giving to create more awareness. The funds go back into lung cancer awareness, research, um, and what have you, everything that needs to be done. When we do these events, things cost money, right? Nothing is done for free. Flyers cost money. The literature costs money. Um, and then
But the most important part, community, is the American Lung Association. They really are on the cutting edge of research around lung cancer, and in addition to that, they have programs that provide support to families who have been diagnosed with lung cancer, and of course, they advocate for common sense rules. Like, for example, I used to be at the American Cancer Society way back in the 90s or the early 2000s, and the American Lung Association and the American Cancer Society actually partnered together to get the smoking ban to pass in New York City back in the day. And so the funds raised through programs like this, I'm sure, goes in advancing the mission.
it goes to all of this. Obviously, I'm not internally, but I raise the funds. I believe in the organization. You know, breathing is important. If you can't
Sure.
breathe, you can't live, right?
Yeah,
So,
yeah,
and,
for sure.
and that's what we're trying to tell people. This is something so simple, right?
Hmm.
You can't breathe, you can't live, and you want to do what you can do to protect yourself, protect your lungs, so you can breathe and you can live a long life.
So when is the week? What's the week for the Turquoise Takeover? So if anybody is watching this and they want to join the campaign, of course you can scan the QR code on the screen. But when is Turquoise Takeover week?
It is next week. We started this week as building up, but next week we have a bunch of um, more events that culminate in our gala. The gala is on Friday. Is at Gulfstream. We're going to be dancing. But
Oh,
cities,
wow.
and if you go to the American Loan South Florida, you'll see all the events that are coming up. We did Cinco de Mayo on Tuesday. There was Sicilian Oven on Monday. Every day there are events in the community to celebrate it, to raise awareness, um, and just bring awareness. Because what I tell people, and I tell people that smoke, right? I said you may not care what it does to you, right? But what it does to the family, it affects the family, right? It
Mhm.
affects if you're a mother, it affects your kids, right? If you're a father, it affects your kids, your wife, it affects everybody else around you. Not it's just not you going physically through it. It puts in a big emotional thing around your neck, burden on families when you're seeing your mother losing her hair. And I know that because although I'm divorced, I still call her my mother-in-law. I saw the stress that it put on my ex-wife,
Mm.
like the stress of her losing her hair, taking it to the hospital. Uh,
Give you a moment to catch up. We're so grateful, Michael, that even though this is something that is obviously something that you and your family are dealing with right now, that you are still passionate enough and committed enough to the cause that you are spreading awareness. And Turquoise Takeover Week is the week of May 10th. And it's an opportunity for you, community members, to join the movement, an opportunity for you to really support a cause, and of course, for you to yourself have a conversation with your doctor about being screened. The QR code is right there on the screen. If you would scan it, you'll learn more about the Turquoise Takeover campaign, and you'll have an opportunity to join Michael in his passionate work to make sure that communities like ours has the information and the knowledge they need to look after our health. Michael, thank you so much for joining us for this really powerful community conversation. And I'm grateful for your service.
Thank you, Commissioner.
All right. All right, Lauderhill, this has been another community conversation. And I want you to make sure that you click on the QR code so that you can join the movement. And of course, again, May 10th, Lauderhill, we are wearing turquoise, all right? Be well.
Thank you.